Hi guys, welcome to my YouTube channel. My name is Dr. Achievement, and I'm coming with glenohumeral joints this time. Last time we spoke regarding sternoclavicular joints. We spoke regarding acromioclavicular joints, and the other topic left is ST joints, scapulothoracic joints. So all these joint complex form the shoulder joints and makes us able to carry out our daily activities easily. All right, so today I'm coming with the glenohumeral joint. So what's the thing you have to know? What is glenohumeral joints, ligaments and joint capsule, blood supply, and mobility? In the mobility and muscles, I will take it in the next topic, in next class. So right now, let's concentrate on what is the glenohumeral joint. Glenohumeral joints is a joint of ball sockets and synovial joints. It includes a complex dynamic and articulation between the glenoid of the scapula to the proximal head of the humerus. Specifically, it is the head of the humerus that contacts the glenoid cavity or fossa of the scapula. All right, we'll move to the next slide. You can appreciate here, this picture is not so clearly showing, but in this picture, we can just manage this a little bit. This is the head of the scapula. The humerus is so big, and the glenoid cavity is very small. I would have gotten a better picture. All right. So now this head of the humerus is articulating with the glenoid cavity of the scapula. All right. Moving forward, the joints have a capsule. The lateral attachment of the glenoid humeral joint capsule attaches to the anatomical neck of the humerus. The medial attachment of the joint capsule is the glenoid and the labrum. According to some source, the overall strength of the capsule bears an inverse relationship to the patient's age. The older the patient, the weaker the joint capsule. With the arm in a resting position, the inferior and anterior portion of the capsule are lax, while the superior portion is stout. The anterior portion of the capsule is reinforced by superior medial and inferior glenoid ligaments, which form a Z-shaped pattern on the capsule. The capsule of the rotator cuff acts to reinforce the joint capsule superiorly. Posteriorly and anteriorly, the joint's capsule provides little support to the glenohumeral joint without the reinforcement of ligaments and the surrounding musculature. So, if you appreciate in this picture right here, this is the capsule of the glenohumeral joint. From this area to this area, this gray structure is the capsule of the glenohumeral joint. So like I said in earlier, the head of humerus is way bigger compared to uh, co- uh, the glenoid cavity of the scapula. So in this case, this capsule is helping to stabilize the joints. But at when we are performing any mobility exercise or anything using the shoulder joints, then the muscles are acting to stabilize the muscles and ligaments. They are acting to, like this, you can see the head, the long head of biceps. They are acting to stabilize the joints down. All right. So, let's move to the next slide. The ligaments. What are the ligaments? We have the glenohumeral ligaments, and it's divided into three phases. We have the superior glenohumeral ligaments, we have middle glenohumeral ligaments, and we have the inferior glenohumeral ligaments. So they try to stabilize the joints at place. And we have the coracohumeral ligaments, which is also important ligament in the shoulder, and we have the transverse humeral ligament. Okay, let me explain in the next slide better. All right, these are the ligaments. Sorry for this slide is not showing so clear. All right, the coracohumeral ligament we can appreciate here. Coracohumeral ligaments. We can appreciate this. We can appreciate the transverse humeral ligaments. We can appreciate the superior gueno, medial gueno, and inferior glenohumeral ligaments. We can appreciate all these here. And all these humeral ligaments, sorry, I did not see a better picture. All these ligaments helps to stabilize the joints at place. All right. So moving forward, the humeral joints, we want to talk about the blood supply. It was found that the blood supply to the glenoid labrum is by direct branches from the second part of the axillary artery, subscapular, circumference, scapular, and anterior circumference humeral, and posterior circumference humeral arteries, as well as branches of muscular arteries supplying the surrounding muscles. So now this is just a little picture I brought. You can appreciate all the nerves passing by. All these nerve helps in supplying to the glenohumeral joints. Most of them. This we can appreciate the subscapularis artery and subscapularis nerve. You can appreciate it this way as well. You can appreciate the axillary artery, the axillary nerve, and the circumference humeral artery. You can appreciate the profunda brachial artery and the radial nerve. You can appreciate at this posterior side, we can appreciate the muscles triceps. This is circumflex scapular artery. So all this helps in making a nice blood supply in this area, and leaving a nice blood supply in this area helps us not to feel any discomfort, because most of bones, the bones especially, need some blood supply and the production of blood as well. Okay, guys, thank you for staying tuned to this short topic, and have a very nice day. In the next class, I'll be taking on muscles. I will be taking on other topic relating to shoulder pain. Thank you, guys.